Hi. Hello, good morning everyone. So, today I'm going to discuss an important topic which is very common now in the present world. So, you would have heard already about stroke. What is meant by stroke? There are two types of stroke. One is cardiac stroke and one more thing is neurostroke. Cardiac stroke is what which is caused by the block to the vessels that supply the coronary vessels. Coronary vessels means the blood vessels that supply the myocardium, which means the muscle of the heart. So whenever there is a block to the blood vessels of the heart, it is called as, it can cause a major stroke, cardiac stroke, which is called as myocardial infarction. Myocardial infarction is one of the major form of cardiac stroke. There are minor form of cardiac strokes like unstable angina, stable angina, non-ST elevation, MI. So these are different medical terms which can only be understood by a medical profession. So just understand that cardiac stroke is something that is caused by block to the cardiac blood vessels, coronary blood vessels, which supplies the muscle of the heart. Okay. Similarly, there is one more condition called as neurostroke. Neurostroke means you would have already heard. It is called as, there are different types of manifestations of neurostroke, like hemiplegia. We call it as hemiplegia, hemianesthesia, or facial palsy. So different types of presentations are there based on type of the blood vessel of the brain that is blocked. So these are all part of neurostroke. So again, neurostroke. So what I am going to convey is, neurostroke is secondary to the occlusion to the different blood vessels of the brain. So the blood supply to the different parts of the brain gets compromised due to block in the different blood vessels of the brain. Okay, so this is in brief about the cardiac stroke and the neurostroke. Now my point is, we are coming across different patients of cardiac stroke and neurostroke across various age groups, in contrast to before. That means before 10 years or 15 years, where a major population of cardiac stroke and neurostroke will be more of from the elderly age group. But now the scenario is totally changing. The group includes both the younger age groups as well as the elder age groups. So what I am trying to convey is, the number of strokes, cardiac strokes and neurostrokes has been increased in the younger age population. So just think of the reasons why this is happening. So I will be covering the reasons in another video. Right now I just want to convey some other information regarding to the cardiac stroke and neurostroke. So it is not only the first episode. So what I am conveying is, not even the first episode, the persons who are coming with a cardiac or a neurostroke is again coming after a few days of treatment with a second attack of a cardiac stroke or a neurostroke. That means a recurrent stroke. This is called as recurrent stroke. So why recurrent stroke is happening? So first I'll tell you what happens when there is a first episode of stroke. A person, whatever is the age, cardiac stroke or neurostroke, goes to a doctor, gets treated, becomes better, and he will be put on some drugs which the patient continues on a daily basis, thinking that he will not have a second episode, and he will think he is alright. He assumes that he will not have any problem in the future. So, but we as a practitioners usually come across many cases of recurrent stroke. That means a person who is assuming, who is already thinking that he will not have any further problem after being started on some drugs, after he had an attack of a first He had first episode of cardiac stroke or neurostroke, comes again with the second episode of a cardiac or neurostroke. Why does it happen? He is already on drugs. He thinks that I am already using my drugs regularly, so why I am having a second episode of neurostroke and cardiac stroke? That will be the first question when they come to us. So what is the reason behind that? So the reason is very simple. When a forest on one side catches up a fire, and on one side you are putting some water, so what happens? The purpose is not served. The purpose is not served. Hence, whenever you are using drugs, be careful of the diet modifications, lifestyle modifications, which is going to help you finally. So the key for preventing the second attack of cardiac stroke and a neurostroke, that means the key to avoid recurrent stroke is the lifestyle and the diet management. Remember that the lifestyle and the food habits that you change is more important than the drugs you take. The drugs are definitely important. They need to improve your condition as well. That is also more important. Don't neglect the drugs, but simultaneously, even more important than the drugs is the food habits and the lifestyle changes. You shouldn't keep on eating something nonsense while you are taking drugs. That means the usage of the drugs you are taking is being nullified by the food habits and the lifestyle habits. For example, you are taking some tablets like ecosprin or clopidogrel for a stroke, and you are eating a pizza, a burger every alternate day. What happens? So no use. So keep in mind that you have to strictly follow a certain diet while you have cardiac or a neurostroke, and along with the drugs you are using. Otherwise, it will be of no use. So this is the information that I want to convey, which is very important, because I have seen many families who is having a recurrent stroke and they are suffering too much. They are economically burdened, psychologically burdened, and so many problems secondary to that. So keep doing all these changes in your life and have a blissful life. Thank you.